What has dentistry to do with flying? For decades, pilots have been trained in sophisticated, extremely realistic flight simulators. Dentistry students develop their drilling skills by practicing on plastic teeth in a phantom head. But now, there is common ground in technology and training. The Moog Simodont Dental Trainer is a highly realistic training simulator that combines virtual reality with haptic technology at its best. ACTA, the Academic Centre for Dentistry in Amsterdam, conducts scientific research, provides educational programs, and delivers patient care in the field of dentistry. In international circles, ACTA ranks among the leaders in teaching and research. Moog Incorporated is a worldwide designer, manufacturer and integrator of precision motion control products and systems. For many years, Moog has been creating high-performance products in flight and automotive simulation that effectively apply haptics technology. The combined know-how of ACTA and Moog resulted in the development of the Simodont Dental Trainer, a highly realistic dental training simulator. Instead of drilling in a plastic tooth, the student can now work in a virtual world complete with three-dimensional images, realistic handling and feel of the drill and the mirror, thanks to the high-fidelity force feedback. The sophisticated courseware supports multiple dental procedures. This can confront the student with many different realistic situations which can improve their drilling skills dramatically. The courseware gives infinite flexibility, tailor-made for any training situation. The Simodont Dental Trainer is a standalone unit that is easy to install, anywhere. Precision motion control instruments built in a sturdy, ergonomic housing which only needs low maintenance and is future-proof thanks to the software-based operating system. Recently, Moog delivered 50 units to ACTA for use in pre-clinical training. And now, the students are working with the Simodont Dental Trainer. What is their first impression?
I think this is an amazing device. Yeah, it's very beautiful.
It's a dream machine. It's really like in the real situation.
You can use this machine for as many times as you want without having to buy plastic teeth.
Yeah, it's very good. It feels line up 90 or 95% like a real drill.
If I compare with old system, I would say this is better because this is the future.
During the ADEE conference in Amsterdam, many specialists and decision makers of renowned institutes in the world took the opportunity to have a hands-on experience with the Simodont Dental Trainer. What is their opinion?
The feel that you get when you drill with the Simodont is very much like reality. I think one of the great things that I've seen so far in the courseware is the ability to stop and go back and review. This is not possible on conventional treatment of acrylic teeth. Once you have drilled the tooth, the material has disappeared. The student would have to start the procedure completely again.
There's a very stark difference between the two worlds here. In one instance, for example, with the phantom heads, you have a very subjective world. So from a faculty standpoint, working with a student, I'm not able to evaluate how you got to your end result. I can only look at your end result and guess. So that's very subjective. We're in this virtual reality world where you have an actual log of every move you made. I can go back and see where you're having a problem. It's extremely valuable from an educator's standpoint.
Dentistry is manually based and skill based, And how do we do that? We still do it how we did it 100 years ago, with the faculty feedback. We have a large classes, large number of students in our classes, and we have the same amount of instructors, even less if someone is missing. We have ideally 1:6 ratio, but we end up with 1:12, 1:15 ratio, sometimes 1:20 ratio. I'm sad to say, but it's true. How do you want to give a feedback? And they are not able to learn as they could if they would have objective, consistent feedback on demand. Yeah. This is so important. As a teacher, you know, with a 10-year experience, plus being a student before for many years, I can recognize the need.
This will be significantly advantageous. And of course, because there are no real teeth and there are no real burrs, the cost consequences of this are very significant to us.
This kind of technology and introduction of this technology into the dental education world can now improve competency to a magnitude level. That's why I'm excited about it.
At UCTA, many phantom heads already made room for the Simodont dental trainer. After all, the software-based concept of this trainer gives endlessly more possibilities for learning.
Dentistry itself has changed because we have changed to minimal invasive procedures, and for minimal invasive procedures it's very important to use realistic problems.
You can scan in very complex patients and they can work on it where normally you would never allow a student to practice that on a patient or to perform that on a patient. That's far too dangerous.
For us, it's very important to bring those real dental problems into the preclinical training, thus closing the gap between the skills training of the traditional preclinical environment and the clinical training where they have to cope with real patients.
We continuously develop, adding new drills, adding new procedures, new instruments, and also we put in more cases, refine these cases, so it's a continuous process of keeping the courseware up to date and expanded, till it finally is a patient.
Thanks to the flexibility of the concept, this dental trainer can keep up with the changing demands in learning. That makes the Simodont dental trainer the ideal instrument for dentistry education.